Hey everybody, this is a good chapter to know since block 1 focuses on the aging adult. So I would make sure that you review this carefully. It's a little bit of a deeper understanding of different theories on aging and talks a lot about ageism. So, when you're discriminating against people with that are of advanced years. I think that's enough about that. Here's your learning objectives for the chapter. So here's the theories on aging. The genetic theory of aging says that the lifespan depends to a great extent on genetic factors. So the person has a genetic clock that determines the occurrence and the rate of metabolic processes, including cell division. The immunity theory focuses on the functions of the immune system. Wear and tear theory, in which organisms wear out from increased metabolic functioning, and cells become exhausted from the constant energy depletion that occurs when the body continually adapts to stressors. The organism eventually wears out from use. The immune response declines steadily after younger adulthood as the thymus loses size and function. Remember that from anatomy and physiology, how the thymus basically goes from this pretty large gland as an infant to basically non-existent. And it causes age-associated changes in the immune system. This decrease in immunity is thought to lead to increased infections and autoimmune disease. Nutrition can obviously play a role in maintaining a healthy immune response in an older adult. Another theory is the cross-linkage, a chemical reaction that produces damage to the DNA and cell death, forms the basis for another theory. As a person ages, cross-links accumulate, leading to essential molecules in the cell binding together and interfering with normal cell function. This is manifested as a decrease in elasticity and flexibility. The free radical theory is based on oxidative stress. The free radical theory is based on, it's just that free radicals form during cellular metabolism, which is true. And these molecules pair up with electrons and seek to combine with other molecules. Antioxidants are thought to protect against this type of damage. So your middle adult years are generally considered to be from ages 40 to 65. And here we see individualized changes in physical and psychosocial dimensions. You should look at your book at the section titled Physical Changes in the Middle Adult Years, and that outlines the physical changes that people in this age group tend to experience or may experience. People have to modify their self-image and self-concept to adapt successfully to the types of changes that happen during this time frame. I mean, really every time frame. An example is hormonal changes. Estrogen depletion in women leads to cessation of ovulation and menstrual periods. When women lose estrogen, they can experience hot flashes, mood swings, and fatigue. I feel like I went through the mood swings in my 40s, and now I just have the hot flashes and fatigue. They also have a greater risk for heart disease and osteoporosis after they have gone through, or after women have gone through, menopause. Men experience hormonal changes as well. And one of the changes that is most noticeable are gray hair and hair loss. I know I've looked at pictures on Facebook from people I went to high school with, and I'm like, oh my gosh, everybody's old. I am too. I try not to look in the mirror. So the middle-aged adult, or those years, are a time of increased personal freedom a lot of times, economic stability, and social relationships. It is also a time of increased responsibility and awareness of one's own mortality. The middle-aged adult realizes that his or her life may be half or more past, and they may feel many times that things are still undone. Challenges for the middle adult stage can consist of changes to employment leading to life changes. Some people may lose a job and need to gain further education to acquire new skills, or they may change careers altogether. Relationships can change during this stage, such as if they have children and their children are becoming independent and moving out of the house, creating that empty nest syndrome. This places extra stress on spousal relationships at times, especially if the focus has been on the children, and now that is no longer all-encompassing. And at the same time, these adults may need to start caring for their aging parents. This generation is sometimes referred to as the sandwich generation because they're taking care of their parents on one side and their children on the other. The physical aging or death of a parent makes the middle adult's own aging and inevitable death a reality. Health problems stem from a combination of lifestyle choices and aging. Preventative care is important to maintain health. The middle adult years are characterized through expanding relationships, either a renewed spousal relationship or a change in partners. Family roles are expanded economically, and the raising of kids and caring for aging parents. These expanding roles can be stressors. See the book for guidelines for health-related screenings, examinations, and immunizations for the aging adult. And this is just a good little slide to be aware of and to recognize. This is the middle adult, ages 40 to 65. Some of the chronic issues that tend to become more apparent or start to cause issues for this age group. Middle age does not automatically result in physical and emotional health problems. Many men and women remain healthy throughout their lives. Knowing preventative healthcare practices and their special needs at this age can help middle-aged adults have improved quality and quantity of life. As the nurse, it is our responsibility to inform, educate, and provide resources to help our patients maintain their health. Society has arbitrarily labeled the older adult as a person older than 65 years of age. The older adult, hang on a second. Yeah, that's where I guess I am. The older adult is defined as a person older than 65 years of age. It's often further divided into the young old, from 60 to 74, and the middle old, 75 to 84, and the old, 85 years and older. I don't think you need to have it broken down that far. You can just kind of maybe picture that in your head if you needed to. Our society is aging dramatically because why? We have technological advances. So a lot of the baby boomers, which were born after World War II, when we had a huge boom in babies, when the men returned from the war, they've already reached retirement age. And so for the first time ever, we have a really high percentage of our population being geriatric. Physiologically, the older adult starts to decline and the body becomes less efficient and response time slows down. However, minds are still sharp and aware unless there is some underlying disease. Due to the reduction in response time, give the older adult longer time to answer questions, or when getting up, allow them more time. They're just a little bit slower sometimes. One cognitive change in an otherwise healthy older person is if they present with a urinary tract infection. This can make them very confused. However, once the UTI resolves, their cognition goes back to whatever their baseline is. See the book for normal physiological changes in older adults, and I would know that list. Let's see. I'm going to see if you need, Erickson's theory identified ego integrity versus despair. And that begins at about age 60. Older adults continue to look forward, but they also look back and reflect on their lives. And it's a time for them to look at the whole of their life and search it for meaning and, decide whether they made a difference. And if they feel they did, then they have ego integrity. And if they feel they did not, or they were unable to achieve their goals, then they may be having despair. Let's move on. Sometimes an older adult is the victim of ageism. I mentioned this earlier. It's a form of discrimination or a form of prejudice in which older adults are stereotyped by characteristics found in only a few members of their group. So keep in mind when you're working with this age group, although response time may be prolonged due to a longer processing time, neither intelligence nor personality normally decrease because of aging. Please do not underestimate older adults. It is important not to speak down to them. It totally works my very last nerve when I hear people referring to older adults as honey or sweetie. So call them by their name and preferably by their last name until they have said, I would prefer you call me Susie instead of Mrs. Smith. And be sure to just be respectful. Listen to their stories. A lot of them have had very interesting lifetimes and experiences and accomplishments that we know nothing about. So if you sit them down and talk to them, you can learn a lot from our older generations. Most of the older adults gradually modify their lifestyle to accommodate for declining strength and health. They rest more frequently, although continued activity and exercise are important for maintaining all physiologic functions. Diet modifications and prescribed medications may also be necessary. Retirement is a life change for the older adult, although it can be a celebrated event. So for many older adults, retirement can be a stressor as their routines change, their income could be reduced, and relationships change. Life-changing roles can be a stressor for some older adults, such as their life partner may become ill, putting them into the caregiver role, or they may need to handle the finances for the first time, and they may not be accustomed to these new roles. Social roles change with the developmental tasks and adjustments of older adulthood, but the need to feel valued, useful, and productive continues. Older adults may develop new hobbies or increase their involvement in the community, church, or in family affairs. They may do volunteer work or even begin a new career. It's important that they develop healthy social environments, as social isolation can become a problem. So let's see, do I care about any of this? I don't feel like I do. You can read through that if you like. I don't know. But as people age, they may become more spiritual or more religious. I think that's the gist of it. So let's talk a little bit more. I know we've talked about it in the past, but when we are teaching our older adults, I know we just recently had a question about it on our exam. We want to repeat and layer the knowledge so that they can remember it for long term. I don't know that that's much different than any age as an adult when we're trying to learn new information. Let's see. Discharge planning for this population takes a little bit more time. It's more extensive and time intensive for these patients. Many times they all have comorbidities and they need access to resources for better medical management. So they may need home health. They may need palliative care. The older adult is at increased risk for accidental imagery because of changes, and I would know this slide, by the way, changes in vision and hearing, loss of mass and strength of muscles, slower reflexes and reaction time, and decreased sensory ability. Falls are the most common cause of injuries and hospital admissions in older adults. 1 out of 5 falls causes a serious injury, such as a TBI, a fracture, and over 800,000 patients are hospitalized annually because of a fall injury. More than 95% of hip fractures are caused by falling, typically sideways. The older adult has a harder time recovering from these injuries. It's important to involve family when they are available, as many people in this population do not express their needs because they don't want to be what they perceive as a burden to family members. Mental impairments are more prevalent in this population as well, so it's important to recognize cognitive deficits in your patients. Many older adults with new onset dementia are not diagnosed, as they typically don't see family often enough for someone to catch on that there may be a problem. Some families think it's normal for their aging family member to become a little confused, and they don't see that they may not be able to perform necessary daily activities. Some patients early on are good at hiding their deficits. Sometimes this population will eat 2 meals in the morning for breakfast or take 2 doses of their morning medications and then do it again for dinner because they forgot that they took it already. Sundowners happens in patients with dementia. These patients present with complete personality changes, and it's like a clock when the sun goes down. If you work night shift, you know exactly what I'm saying. So I'm trying to think. I think that's enough on that slide. So spices is the assessment for our older population. So we're looking at different, we're looking at all these different things that are going to help our older generation. So what do we need to do to get them back to their baseline functioning, or hopefully independent? And how can we determine what their strengths are so we can capitalize on those? We want to prevent complications of them having, like, for example, they come in with pneumonia and we don't get them up, and now they have a pressure injury and they became weak, and then they got up without pushing the colite and they fell and broke their hip. So all of those are complications we want to prevent with our good nursing care and setting up a safe environment. And then, I don't know, that's good enough. We always want to get them back to baseline. You know, that's the ultimate goal. So the spices tool, it helps us to identify common problems in the older adults that we see, so that we can address them and hopefully negate the outcomes that we can see if we don't notice. So it's not a tool specifically used for the assessment of dementia or delirium. It actually just provides information on older adults so that we can prevent and detect common complications. And it's a quick way to identify interventions to individualize care to keep them safe. Elder abuse is defined as intentional act or failure to act by a caregiver or another person in a relationship involving an expectation of trust that causes or creates a risk of harm to an older adult. A victim may deny abuse or choose not to report it because of shame, fear of abandonment, worry about retaliation, or dementia. All assessment data should be objectively documented, including direct quotes from both parties. So, I know I had maybe 2 semesters ago a student who was a CNA, and she had an older adult male who was being cared for at home by his family. And his whole family was there because he came in, I don't remember what his diagnosis was, doesn't really matter. But one of the main things that was uncovered during his stay is when he got there, they'd always do a 4 eyes assessment which is a head-to-toe skin assessment. And he had major pressure injuries, especially on the coccyx, around the scrotum, in the groin area, and he was incontinent of bladder and bowel. So the family loved him, and they rarely left him alone. They really respected him. They treated him so nicely. But what was uncovered during the time that they were all there is that the family said that he was unable to get up anymore, and so they just let him sit in his recliner. So the hospital had to end up reporting the family to Adult Protective Services, not because the family didn't love him or feel like they were taking care of him, but they did, maybe even unknowingly, neglect him by not taking care of keeping him clean and dry, so his skin broke down. So it's not always a negative when we have to contact Adult Protective Services, because it might simply be, it doesn't mean that they're going to take him away from the family. It might just simply be that they get them additional resources, or they provide further training to, bring to their attention that they can't do it the way they're doing it. All right, older people should definitely exercise to prevent muscle wasting. A lot of gyms have silver sneakers programs, and it's free for Medicare recipients. Other gyms have special classes designed just for older people, and it's great for their socialization because it gets them out of the house and they can meet new people and enjoy their company. There are many options for housing for older adults. Many are listed here. It depends on their level of function and their care needs. So I just want to point out that there is that fallacy that everyone feels that older people end up in long-term care facilities or living in some type of facility where they need additional assistance. And that is not true. It's a very small portion of the population. And this is the end of this chapter.